My name is Jason Peterson. I'm the DHS designated, navigator, host, liaison, what is it? Facilitator. That's the word we decided on, facilitator. I'm the facilitator of the Medicaid Client Voice Council meetings, and welcome to our first meeting of a new year. Happy New Year, everybody, 2026. We have some new members we're going to meet a little later. We're going to do that a little later in the agenda, so hopefully all of the people who are coming will be here and we can meet each other. I'd like to welcome DHS leadership who's here in the room. Our secretary always intends and wants to be here at our Medicaid Client Voice Council meetings. She had a conflict this morning. She will not be here, but several of our other DHS leaders are here either for presentations or they're in the room for the open discussion part of the meeting. So if you have questions about a particular area of the Department of Human Services, they'll be able to help answer that question. If you have a question and the DHS leadership that we need is not in the room, I will take note of that question and get it to the right people, and we'll correspond via email as a group, and you'll learn the answer to those questions. So especially welcome the new members. At the second half of the meeting now, for the new members, we're going to elect a vice chairperson. Jennifer Yeager was our vice chairperson last year. She now ascends to chairperson, and we're going to hear from her in a moment. But the vice chairperson who we elect will have two main roles. One, you will attend the Medicaid Advisory Committee meetings that follow the Medicaid Client Voice Council meetings. They're immediately after in the afternoon. You'll get lunch between 12 and 1, and then the MAC meeting begins. So you'll be one of our three designated members to attend those meetings. And two, you will then ascend to be the chairperson next year. So think about if that's something you'd like to do if you're a new member, and think about your best argument for why you should be the chairperson, because you'll have that opportunity around 10:30 or 11 o'clock to make your best pitch for yourself, and then your fellow members will elect a vice chairperson to serve alongside of Jennifer. So, Jennifer, I'm going to grab a mic and we'll let you make some opening remarks. Yes, there are people online watching via Zoom, and if you have a question and you're watching online, you can text me to my personal number and I'll include it and ask our presenters your question or make your comment. You can also let them know, you raise your hand, like on a Zoom, and we can try to get your voice. I think we have the technology where we can actually hear from you and hear your question. If you're in the room and during the discussion part of our agenda or during the Q&A, wait until a microphone comes to you, because if you talk, yes, everyone here in the room will be able to hear you, but if you don't have a microphone, no one watching online can hear you. So, raise your hand. I'll bring you the microphone. I'll walk around, and we'll make sure that people online can hear the discussion and everything that's going on. So, Jennifer Yeager, I'd like to invite you to make some opening remarks.
Hello, everyone. This is my second year on the council. So last year I was the vice chair person, and I'm from Northwest Arkansas. I actually live in the farthest place in Northwest Arkansas, between the Missouri and Oklahoma border, so I traveled a long ways. But I think last year we had a lot of changes, especially with the online application forms, and that was a huge deal for everybody in Medicaid, I believe. And so this year, I think our main focus is just to continue making changes in the best, for the future, and maybe trying to work on the entire Medicaid population and not just focusing on one, because I think we did that a lot last year. So that's my opening statement.
Thank you, Jennifer. Yeah, we know that all of you are served by Medicaid in some way, and you may have issues come up in your life with Medicaid-related programs, and we will do our best to help you individually with those, but we're going to concentrate as a group on more holistic approach of how can we improve Medicaid services to the entire state, to the general population that receives it. You should have in your folder a welcome packet questionnaire. You can fill. This is mainly for the new members. The returning members filled this out last year, but it'll give us an idea of what's on your mind. Also, there's I need your biographical information. There's some questions there. We will put a bio of you online. Stephen, where'd he go? Here he is. Stephen's going to take your photo during a break, and so that'll go online along with a little write-up that I'll let you approve. I'll write it, send it to you. As soon as you approve it, we'll post it online. But that will help me write a better bio for you online. And for returning members, if things have changed in your life, maybe you've moved, you have a new city of residence, maybe you've added a member to your family, whatever the case may be, you can also update your bios. You can use that to get me updated biographical information. If you need the Wi-Fi, the guest Wi-Fi username is MCVC guest. That's your username. And the password is guest 2026 MCVC hashtag. That's the password. If anyone forgets it or needs it, it's right up here. You can come up during a break and write it down. We had a little juggling of the agenda this morning. I mentioned that the secretary can't be here. She's in a meeting with our first presenter right now, Elizabeth Pittman, Director of Medicaid Services, Division of Medicaid Medical Services. So she'll be arriving shortly. So we've just flipped the first two presentations. So we're going to start this morning with comparing the passes. This is something that got brought up a lot last year here in our meetings. Act 962 of 2025 is a law that intends to improve the enrollment and selection process in risk-based provider organizations. So we have Paula Stone, Director of the Office of Substance Abuse and Mental Health, along with Tabitha McNulty, Deputy Director of the Office of Substance Abuse and Mental Health. They're here to discuss the implementation of this new law, and they'll answer your questions about how past members can better compare the four different passes and the services and programs and providers enrolled in them, and what this law intends to do. So, ladies, also we've got a summary of the act that is being copied right now. It'll be distributed to you momentarily, but they're going to talk about the act and its implementation. Hey, Tabitha.
Hi, good morning. I'm Tabitha McNulty. So really, this is a pretty simple act. It's pretty straightforward. The intent of the act was it will require the passes to put on their websites some information, some basic quality ratings. And what you'll see from the summary that we've shared with you guys, the measures will have to, at minimum, they can include more. The act allows them to include more if they want to, but at minimum, and I want to say that all of these things that the act has, it's already information and data that the passes are already collecting. And so it's not that the act required them to collect some new data. It's already data that's out there and it's being collected. And so they will put the timeliness of service delivery for waiver recipients, care coordinator caseload ratios, member satisfaction. And the member satisfaction piece is really kind of broad. It goes across lots of domains. It's not just very simple member satisfaction. Like, as an example from the act is satisfaction with care coordinators by individuals, satisfaction with the website or the portal, and so it's pretty broad, the satisfaction piece. Follow-up care rates, post-emergency department visits, well-child visit rates for members aged 3 to 21, timeliness and frequency of care coordination contact, and then incident of complaints or grievances. And so the idea is that the passes will, they've been working to internally compile this information. Like I said, it's not new information. They already have this data, and they're putting it on their websites, and will be giving themselves a self-assessment pursuant to this statute. And then the agency will take all of those assessments, and we will link. We will have we're doing a OSAM, where the PASS system is housed at DHS. We are doing an upgrade to our website. We've been working on some things for our website, and so there will be a link to each PASS's rating from the DHS website. And so that, in a nutshell, is what Act 962 accomplished. So just real short and sweet and pretty direct. Have any questions? Yeah. No, it's okay.
How are the satisfaction surveys completed by the passes? Is it a third-party vendor that collects those, or is it the care coordinator that gets there from the member?
I'm not exactly sure. I think they all four do it differently, but because I know that one, they do use a third-party vendor, but I don't know off the top of my head how each of the four do their satisfaction surveys.
I'd love to know, because I know, like, it can be a little biased if your care coordinator, because you don't want to tell your care coordinator, no, you're not doing a great job, or, I mean, I just wondered how that was collected.
Yeah.
Thank
And this
you.
act doesn't have anything to do with the collection of the data. It is just the presentation of the data, the sharing of the information. It doesn't put any requirements on them on how they collect it, because I do understand your point.
Thank you.
Mm-hmm.
Any other questions about maybe if you're new, you're unfamiliar with the passes and what they do or what we're talking about? If you have a question about that, we could definitely answer that too. Yes, Karen.
Yes. Okay. My question is, the information is online on each website, but what about people who don't have access to online? Because my child has a care coordinator, and I have absolutely no clue as to what she does, or what services they provide for the client.
Well, and I think that that's a little separate from what the act is addressing. But if you have issues with the care coordinator, I'm happy to give you my contact information and we can get you in touch with the ombudsman, because we definitely want to make sure that your son is having the contact with the care coordinator that's required under the PASS agreement, and that the services that the members are entitled to get, that they're receiving those services. So I'm happy to give you my contact information so that we can help and make sure that that's corrected. Yeah.
Any other questions? This is your chance. All last year we had a lot of discussion about the passes, and some do this, some don't do that. We wish they were more similar.
I think what kind of disturbed me a little bit more about that comment was that they don't know what their care coordinator does.
Right.
So I know there's education that goes out, but I experienced that yesterday from the provider perspective on a CQL interview. I had to they literally stopped and said, well, what are the passes and what do they do? So I explained to them, but I mean, that's our accreditation people for waiver providers. So I don't know. I know we've come a long way with that education piece, but I think there needs to be probably more, and I don't know how we do that, but we can work together and that's in general for any caseworker. Somebody asked me, provider the other day for my son, for our home, we'll go to his caseworker. And I'm thinking, did I miss a memo? Does he have a caseworker for our home? And maybe he does, I'm just saying in general, the care management piece and the caseworkers, if there is one. So y'all can thought, well, I'll ask him today, does he have a caseworker? But the provider thought, literally, I have a caseworker to go and talk to for our home for my son. Right. So I'm just saying in general.
Oh, yeah. Appreciate that feedback. Thank you.
Yes.
This is kind of more of a general thing that came up this year, but it does talk about the passes being transparent. Mm-hmm. And that one of the passes this year, January 1, or actually after open enrollment had ended in November, I think it was November 13th, released a new fee schedule and substantially changed the structure for how they were doing supported living services, which caught a lot of people by surprise because it didn't allow providers to make choices ahead of time. And it also a lot of members were switching to that pass under the impression that something was going to happen that didn't, and then they weren't allowed to then change back to their old pass because they had made concessions. There's always something you give up to make a choice. And so some of those things, they weren't able to go back to their care coordinator that had been consistent and that kind of thing. So,
right.
Yeah.
And one thing I didn't mention about this act, it's not directly to that point, but one of the things that this act also does is it has a provider directory requirement. So again, it's not to rates, but the provider directory requirement requires that the passes have, that members have real-time access to the provider directory, and that if there's a change in a provider, that be updated within 10 days. So I'm sorry I didn't mention that piece.
Let me get Catherine first.
Okay, so if I'm understanding exactly what it covers, will the data that's collected be provided like side-by-side comparison, or will it all just be individually under each?
Yes.
Okay.
So the statute requires that Empower put it on their website, ATC put it on their website, Summit put it on their website, and CareSource put it on their website, and then it requires the agency to have a link on our website.
Is there a list of specific data they have to provide?
Yes.
Versus what they can add?
So the document that we handed out, it's a summary of that list.
Okay.
But the statute lays. I mean, I just did a summary. I didn't want.
Yeah.
The statute lays out the data.
Okay.
Directly.
Okay.
And it's mostly the satisfaction surveys.
Yeah.
It's mostly is what it is.
Okay. Thank you.
And so too, the statute doesn't lay out like how these things are weighted. So like is one thing supposed to be, so it doesn't lay that out. So when you're looking at it, I'd be mindful of that.
I think Catherine was probably talking about, we talked last year about for parents, it'd be easier to look at side by side.
Yeah.
And for them to have the same requirements for specialty providers and that sort of thing. But I'm glad that we've come this far on that.
Because that might be kind of hard, right? Because
Yeah,
there's
it
a
would
lot of
be.
information on just one pass, right? And to have all of that information side by side would be overwhelming as well.
I think just for a parent, we take all that into consideration, and we're having to call each of the
Oh,
passes,
for
which is
sure.
fine
Absolutely.
to see what providers are in and what are not. And then, like that situation, we dealt with that from a provider aspect and angle, and it was kind of, we were really taken off guard. And where I work, we have over 800 members but we had about 300 that affected. So that was a really big thing. I just want to give a shout out to the state for Summit. Summit sent out, that's my pass for my child. I love them, their enhanced care coordination. They sent out an impact report that was phenomenal.
Oh, good.
That was specific to Arkansas, and it had a lot of different stuff. And I think I have it in my backpack, but it was really great. And I'll show it to you. I'll definitely show it to you, Paul, if you haven't seen it. But for a parent to see that, and then a provider to see that, it just tells us all the different things we didn't know about. They send out a newsletter. They have a wonderful enhanced care coordination team. But I just wanted to give a shout out to Summit
That's
for
good. I'll
putting
share
that
that.
out
They'll love that
because it
too.
kind of relates to what you were the act you were talking about.
Summit is very mindful of sharing things that they do, especially with their in-network provider group and with their members. So I'll make sure to share that with them.
Actually, do have it, and it's awesome. It covers everything.
Oh, great.
Coordination, their network, their member impact, their value-based programs.
That's great. Thank you.
And that's it goes right along with what I was about to say. I was just gonna say that know that each pass is different because with my kids, we've had Total Care and Summit, and the first initial meeting, their care coordinators explained what their job roles were, and overly above that, they were just like, any assistance that you may need, I'm here. I'm your go-to person.
Right.
I'm here to lighten the load. Help. Make your experience a little less stressful.
Yeah.
Because it's already a challenge when you're dealing with behavior health or mental health
Right.
or whatever. That's already a struggle. And so for me, and I've said this before, they have been a great deal of help to me. Now, I did switch from Total Care with that one child simply because I wanted my kids to see the same person.
Right.
And that made life so much better.
That's very normal. Yeah.
Yes. And so they overly communicated. And I got that overview, what she was talking about. I received that as well. And all the way up until when their assessments are due, they're reaching out like months in advance, like, hey, go ahead and get that schedule. Like they just help me be more organized and just make life so much better. I just had to throw that out there.
And this is good feedback. And I think that, Act 962, I don't think that there will ever be a perfect way to capture all of that, across the board, right? But I think that it is a step to what members and their families desire when it comes to wanting to know more about the passes and what they have to offer.
I just wanted to add just so you guys know, Empower actually works to put those siblings together as well, and they have a team that will serve. So just wanted to give a shout out for their model with that.
And Tabitha, you mentioned an ombudsman. Is there one pass ombudsman, or does each pass have their own ombudsman?
No, so the agency, we have an ombudsman. We have two ombudsmen, and one is kind of more member directed. They both are very knowledgeable women, and both are extremely helpful. But one does kind of turn a little more to provider issues and works those, while the other one kind of trends a little more to member issues. And so on our website, there is a number to the ombudsman office. So if you're coming from a provider's perspective or a member perspective, that you can reach out, and that's what they're there to do. They're there to help.
Any other questions for Tabitha? Yes.
Question is the waiver. Can you I'm in the process of trying to do one. I'm not sure where to go, but would that be through my pass or is that through DHS?
So a new waiver provider.
Or to try to apply for a waiver for a child that apparently, I think they're having more mental health than behavior.
Okay.
And we're trying to get the testing needed to see. And
You want to
I was told to apply for a waiver, but when I spoke to the care coordinator, she told me to contact DHS, and when I go to DHS, they're telling me to contact my care coordinator at Summit. So,
You're in a circle.
yeah.
Hi, good morning. My name is Kimbra Butler. I am one of the assistant directors with DDS. I can actually help you directly. So I'll get with you after this, I guess at the intermission maybe, and I can provide you with some support on that.
But I also want to state that if it's mental health issues or related to behavior, Kimber can help if it is if there's an intellectual or developmental disability. So if it's not an intellectual or developmental disability, sometimes people do get those things confused and say that you need to apply for a waiver. But if they're in the past and they came in through the behavioral health door, I'm not sure if they're going to need additional things. So I think, when you talk to Kimbra, let's just make sure that that they do have an intellectual disability. And then we may also want to talk, if they're already in a past, like what is the service that they need that they're not getting, right? So Kimbra, if there's no intellectual or developmental disability, and it may also be easier since it's a past member already, that you just give your information, your child's name. If you will, just give your child's name and date of birth to Tabitha, and we'll go back and see what's going on and make sure that they don't need additional services, or if we're just making sure that the pass, right, because they can already give additional services. So we just want to double check that.
Thank you, Paula. Thank you, Kimbra. Any other questions for Tabitha? All right, Tabitha, thank you so much.
Thank you.
Appreciate it. Thanks. I see Elizabeth has arrived from her meeting. So we were going to go back to our first agenda item, which is Medicaid 101. And now Elizabeth Pittman is the Division of Medical Services Director. She's going to give you a quick primer on Medicaid and the programs it helps fund in Arkansas. Starting with the difference between Medicaid and Medicare. That's something that if you're new to the council, maybe you need a little explanation about. So Elizabeth, come on up. You can use a stick mic or this, whichever you prefer.
I'll stand there.
Okay.
Good morning, and thank you guys for being flexible. Sorry to have to push this back. See if I can remember how to use technology today. Jason already introduced me. I'm Elizabeth Pittman. I'm the Director of Medical Services. So medical services, in case you want to know, what we do is we pay providers and claims. So we make sure providers get enrolled and claims get processed. We also set policy for medical services. So physician services, hospital services, ambulance services, anything that's kind of on your more traditional health insurance. That's what DMS does. All right, so what is Arkansas Medicaid? You'll hear us saying, when you work in Medicaid long enough, saying if you know one state's Medicaid program, you know one state's Medicaid program. Unlike Medicare, each state has a different Medicaid program, and they all look different. So just because you learn Arkansas Medicaid doesn't mean you can take that knowledge over into Missouri or Tennessee and understand their program. They may have different services, different requirements. So that's one thing to know. That's not like Medicare. Medicare is the federal insurance program that pays medical bills for the elderly is the primary population you're aware of, 65 and older. There's some other populations as well, but it is the same every state you go to. Medicare is Medicare. They also serve people with disability that might be younger. They provide essentially the same benefits to all recipients, and it's paid directly to providers just like health insurance. So what's Medicaid? Medicaid is the assistance program that serves low-income individuals of all ages in a state. It's not just low-income, though. It also serves those with disabilities, and it's the primary payer of nursing home benefits for individuals in states. So Medicare only covers like the first 60 days. Medicaid picks up long-term stays in nursing homes. Programs vary from state to state, but states have to operate within the federal guidelines. And if we want to change those guidelines, we have to seek approval through what's called a waiver. Again, we pay funding directly to the providers through the state program. It's sort of like health insurance. Although we're a little bit different than health insurance, you can think of it very similar. The health provider bills Medicaid, and then we pay them. So every state has to submit what's called a state plan. The state plan is a very long document. You can find it on our website. It's about 1,300 pages, and it's awful. But if you're really bored one night or you can't sleep, it's a great way to fall asleep. But it is our agreement with the Centers for Medicare and Medicaid Services of what we're going to cover here in the state of Arkansas. And it has to be in that state plan for the feds to give us our money for it, right? So if we want to cover a benefit and draw down our state dollars, we have to have it in our state plan. And if we don't want to follow the rules of the state plan, we have to submit a waiver. So what is a state plan? Again, it's the formal plan on what Medicaid's going to cover. You do not have a cost or a budget requirement. If we put it in that state plan and we're following our rate reimbursement pages, we pay for every person that qualifies for that service without regard to how many people qualify or what the total cost of that is going to be. Typically, it's a 90-day process to get a state plan amendment, or you'll hear us say the word spa. It's not the fun spa where you get a massage. It's the one where you submit to CMS and they put it on a 90-day clock and ask you a bunch of questions. That typically is a 90-day process. They have something they call request for additional information that allows them to stop that clock and ask us additional questions if they're concerned about the spa that we've submitted. Once you make a plan change, it's permanent. And to make another one, you have to go in and do another state plan amendment. So there's not a time limit on a state plan. And again, that's any service that we cover in Medicaid. We have what's called mandatory services and optional services. All of our mandatory services are going to be here. So this is your physician's benefits, your state plan, your hospital benefits. This is where you're going to find your basic nursing home benefits, your basic therapy benefits like physical therapy, occupational therapy. That's all going to be at our state plan. A waiver request is a formal request to CMS to do something that isn't really allowed by the statute. So, for example, for the CES waiver that you were asking about a minute ago, the Community Employment Supports Waiver for individuals with intellectual or developmental disabilities. I told you with state plan, if you qualify for that service, we cover that service, right, without limit to how many people. For Community Employment Supports Waiver, we say, we have this much money, we can afford to cover 7,000 people, and I made that number up. Kimber could probably tell you the exact number, but let's say 7,000 people. So we're going to offer 7,000 slots. And when we hit that 7,000 slot, we don't cover any more people on that waiver. We put you on what's called a wait list. We have to actually ask CMS for permission to do that because that's outside of their normal rules. So that's called a waiver. The same with the PASS program. Because we limit who you can choose as a provider in the PASS program to those PASS networks, we get a waiver from CMS to do that. And that's through what they call a 1915B or a managed care waiver. So that's what a waiver is. It's us saying to CMS, we would like to do things a little bit differently, and they give us approval to do that. And those are time limited. Typically, they are 5 years, or they can be less than that, 2 years. But typically, once you kind of have the program rolling, it's a 5-year renewal process. So these are, and Mary can talk about these a little bit more than I can, but these are all our different eligibility categories. I'm not going to read this to you, but these tell you our primary eligibility categories. There's actually a lot more than this if you ask Mary and Brianna, but these are the primary ones that you'll have heard of and how many people we currently have enrolled. And as you can see, we serve about half the children in the state of Arkansas. So like I said, I'm going to go over those numbers a little bit for you before I get to this. We do serve about half the children in the state of Arkansas, so about 1 in every 2 children is served by Medicaid. And we serve about 1 in 3 individuals in Arkansas, so about 1/3 of the state. It's a little bit less now, but that is about how many we serve. So we're actually the largest health coverage provider in the state of Arkansas. So because of that, we have a lot of providers. We currently have almost 120,000 providers enrolled. Now that includes your direct support professionals. So if you receive personal care services, somebody that comes in and helps you with clothing, bathing, toileting, those activities, they're enrolled with us and have a number just like everybody else. So that's why that number is so large, because all of those people have a number. That doesn't mean they're direct billing us. So if you look at that comparatively, only about 12,500 of those providers are actually billing us. So the majority of those providers are those individuals who need a PIN number, so we put them on the claim. We like to know who's actually providing the service, as well as who's billing it. So all of those people that are coming into your home have a Medicaid ID, and they're actually on the claim when they get billed to Medicaid. So we know who they are. We have 76 different provider types in Medicaid. We're actually running out of 2-letter combinations. We're having to get creative, which is not fun for tech people, I have to tell you. They're not good at that. Anyway. Again, these are more Mary's area than mine, so if you have any questions on this, she'll come up here and help me. But general eligibility, we have income limits based on the percentage of federal poverty, and they put out that number every year. I think it's in April, isn't it, Mary, that they put that out? So that changes every year. It ranges from less than 20% to up to 250% of federal poverty, depending on the category. You've probably heard of Our Home. Our Home is our healthy adult benefit for 19 to 64. It is up to 138% of poverty. And we have a few categories that go up higher than that, like pregnant women's Medicaid or our waivers. Limits are higher, like I said, for children, pregnant women, and long-term services, and limits are lower for healthy adults. We determine clients' eligibility every year. That is changing under the, whatever it's called now, the OBBBA, the One Big Beautiful Bill Act. For the Our Home clients, they'll have to be redetermined every 6 months starting in 2027. For everybody else, it's still a year. And clients are required to report changes in their circumstances within 10 days. Some clients do have to meet asset limits. So there's a resource test as well as an income test. And some also have to meet an institutional level of care. So they have to meet a medical criteria. So for example, the waiver, you have to meet medical criteria to be on the waiver as well as the income and asset. So this is a chart that's showing you what those current annual limits are. Again, I'm not going to read this, but you will get a copy of this, I believe, Jason, isn't that right? So you'll have this to use. And it's handy. I use things like this all the time, get Mary to send them to me, so because you're never going to remember all that, right? I think they do, but I'm never going to remember all that. So that's just a very brief overview of what Medicaid does. It's I say every day that I learn something new about Medicaid. Every day I go to the office, and I've been doing it every day since 2019, and kind of off and on since at least 2013 in different capacities in my job. And I still learn something new every day. So it is a never-ending learning process. It's a complicated program. And we're always figuring something out. So if you ever have any questions, trust me, we are still figuring things out too, so we understand. Please reach out to us. Ask those questions, whether it be about eligibility, about the benefits you cover. Just so you know, I have a group of nurses that works for us in my prior authorization utilization management team. They work with clients all the time to understand what benefits they get, how to access those benefits, how to get their doctor to make the requests they need to make. They're happy to walk you through that if you have questions. Because again, I don't remember all of it. It's a lot of information. And I'm happy to take any questions.
Elizabeth, can you remind us again when that work requirement goes live for the Our Home? Because I have 2 kids on Our Home, and I want to make sure I don't miss it. And just a shout out to Medicaid for what we took to y'all about needing more, like a letter notification when eligibility is coming, or you guys need something else. That has worked because we got an email, Mary, I don't know where you are, and a text and a letter. And I'm like, yay. There's no way we could have missed turning in stuff. This for my daughter for her Our Home.
Good.
So thank y'all for that.
So we will have a presentation later today on Our Home, and then we're also going to come back later this year to give you an in-depth presentation on what that work requirement is going to look like. But it starts officially on January 1st, 2027. That's when you can get disenrolled. We're going to pilot it starting on July 1st. It will not have any consequences. So what we're going to do is it's an information campaign, an education campaign. So we'll run the eligibility, and Mary can describe this a lot better, so I'm just going to give you the brief overview. But we'll run the eligibility as if that work requirement were in place and tell you what would have happened had we been doing it. So you'll have the opportunity to kind of see where you are before we actually implement that.
Any other questions about Medicaid programs? What is funded, what isn't funded in Arkansas by Medicaid? Good, everybody think they got
If you
it?
ever have that question, and trust me, I have that question all the time, just give us a call and we'll help you out with that, okay?
So this is a good foundation, especially for new members as we go forward in your 2 years of service, just to get this baseline knowledge. Here's your glasses, Elizabeth. Let me see if they work for me. Yeah.
Yeah, they're just readers.
We do this in the January meeting every year. So those of you who are returning members heard this last year. Hopefully, maybe picked up something that you missed last year. But we are in line right now on your agenda to take a short break. What we're going to do is, if you are a new member, Stephen wants your attention. He's got a setup over here where he's going to take your photo, and we'll have it for the website, for the newsletter. So smile pretty or handsomely, whichever the case may be. And so take at least a 10, 15-minute break. You could use this time to work on those questionnaires that are in your packets. If you need to come up and get the guest Wi-Fi again, you can. And after the break, we will meet all of the members, returning and new members. That's where we'll start when we reconvene. All right, welcome back from the break. Hopefully all your pictures turned out awesome. Well, you'll find out once they get posted for the world to see. Actually, some of them, yeah. Stephen does a great job. He, if you don't know Stephen Thornton, he worked for years and years as a photographer with the Arkansas Democrat-Gazette. And he got to a point in his life, as I did, came over from media to join a state agency, and we love working here. And so he does a great job telling the stories of DHS, the positive stories, whether it's from a human development center or whether it's from a press conference, or just likes to get the positive stories out about the agency and the people we serve. So we'll share your story. I talked about the biographical information that's in your folder. Some of the new members came in after I had made a couple announcements. One announcement is, if you're watching online and you'd like to participate in the discussion, we are monitoring the Zoom call, and if you're an MCVC member, just use raise your hand online, and we can incorporate you with your questions or your comments. For those in the room, you need a microphone in front of you when it's time to talk, or the folks online can't hear you. So when we get to a point of discussion, whether you're telling about yourself, which we're going to do here in a moment, or whether you have a question or a comment during an open discussion period, wait until I bring you the microphone so that everyone at home and in the room can hear you. We have the mics in the room. It does help a little. You would be able to hear me even without them, but for people at home, they would not be able to hear you. So you need the microphone in front of you. So now we are going to meet each other. Some of you are here for the first time. Some of you are starting your second year. We're going to start with the returning members, two of which could not be here today. Hopefully you'll get to meet them at our next meeting. Corey Rowe and Shannon Long are returning members who could not be here. But we're going to start with our chairperson, and then I'll bring the microphone around to all of the returning members. What we'd like to know is your name, where you're from, maybe some hobbies or interests, why you chose to apply to serve on the council, and maybe what you hope to accomplish as a member of the council. So we'll start with Jennifer Yeager.
And so I was on both sides of Medicaid. I do, patient care, and I had a child that was on Medicaid. So that's kind of why my interest was in coming on board with this last year. And it was a great year. And then I told him, say something interesting about yourself. I have 2 kids, and we all race dirt bikes. So that's kind of the interesting fact about me.
So somebody's gotten injured along the way, right? Look at the scars to prove it. But you still ride. Okay. All right, Lakeisha Swanigan.
Hello, my name is Lakeisha Swanigan. I live here in Little Rock. I'm originally from Brinkley. I work for the state of Arkansas. I've been in my current job for almost 8 years. I have 3 children, 2 boys and a girl. Some of my hobbies include working out, painting, pottery. I joined the council to get a little bit more insight regarding Medicaid and Medicaid benefits and programs. What initially brought me to join and find the Medicaid Client Voice Council, my mom had a stroke, and I was kind of looking for resources to get her the help that she needed when I found the Medicaid Client Voice Council, and it said to apply. And I was like, well, what better way to get knowledge and resources for her than being on this council. So once I did join the council, I did get a better insight as to what I could do to help her. Because before that, I would just get the runaround and didn't know what route to go. I have utilized Medicaid services for myself or either my children for most of my life. So I know a little bit about the Medicaid, but I don't know like the ins and outs and how the programs work and what all it consists of. So I joined the council to get a little bit more insight as to how I can utilize its benefits.
All right, and I was talking to Lakeisha about where our members come from and that we were underrepresented in a certain region, and she said, "Oh, I have a sister that lives in that region. She may like to join the council." So let's meet Jeralisa Swanigan.
Hello, I'm Jeralisa Swanigan. I live in Brinkley, Arkansas. Of course, Lakeisha's my sister. In Brinkley, I serve on the school board and different committees within the community, just being a voice for the people in my community. And also, I have 4 children, 2 girls, 2 boys. 3 of my children are on, they use Medicaid services. And then also I have a disabled brother who's autistic. And so he used some of the services as well. And of course, as Lakeisha said, our mom had the stroke. So again, just like Lakeisha stated, just trying to learn more about what's available and also be that voice to speak up, to report any issues that people may have, challenges, to see how we can make it better. I'm just an agent for change.
All right, thank you. Next, returning member Catherine May.
Hello, I'm Catherine May, and I'm from Hot Springs, and this is my 2nd year on the council, and I have 4 children. They're grown adults now. 2 sets of twins, actually, a boy and a girl and a boy and a girl, and 3 of them are on the autism spectrum and have all the different levels of needs and supports and just anyways. And so I decided to join to learn more information, even though I feel like I've learned it all, and to just get a better grasp on what it looks like for them as adults and to help to go back to our community, and because there's a huge community of people with disabilities in Hot Springs, and share the information I learn and encourage my other friends to apply for future council spots.
All right, and our last returning member that we have here today is Amy Cobb.
Hi, I'm Amy Cobb. I live in Malvern. I have 5 children. 4 of them have disabilities. 3, well, all of them have autism, and 2 that have high complex medical needs as well. I'm honored to serve on the council. I've worked in different settings. I'm now with a waiver provider, but I've worked at a PASS, and I've learned a lot. Moved here to Arkansas from Mississippi. I'm always learning. I'm just glad to be on the council to try to be a voice for change. I think a lot of things we've done have moved forward, and that's really wonderful for the Medicaid population as a whole. I'm just in this to hopefully make some changes make things better for kids like my kids as they learn and they grow. And I know that we have things, I want us to be the best state that we can be for services for people on the waiver and for people that receive Medicaid, and just make sure they get everything that they deserve and they need so that they can be as independent as possible. I don't think I do anything interesting other than to take care of the kids, but I do also serve on Arkansas Autism Foundation as a board member and on Arkansas Children's Hospital as a complex care family advisory board member. I don't know how I got on that, but it's a fun group too, but not as fun as you guys, so.
And I got a dirty look from the back of the room from Jacqueline because she said, "Wait a minute, I'm a returning member. Don't forget about me back here."
I'm Jacqueline Bettis. I've been on the council since January of 2025. I joined the council as an extension of the many advocacy programs that I participate in across Arkansas. So I'm a former Miss Wheelchair Arkansas. This year, one of my most recent accomplishments is that I'm about to debut in a national docu-series called Dual True Cost of Care. It's sharing the stories of the complexities of dealing with dual coverage between Medicare and Medicaid. Thank you.
All right, thank you, Jacqueline. Yeah. So, Now we have our new members. We'll start here in the back, right behind Jacqueline. Noel Rodriguez.
Hello, I'm Noel Rodriguez, and I joined my family as I'm the only person with a disability in my family with verbal services. I'm here to advocate and to bring more awareness to Northwest Arkansas and be a person with a disability who bring not annoying questions, but stuff that bothered me to the table to my fellow people in the same scenario can feel like they have a voice in Arkansas. And also, I'm with my team advocacy group, and this is the new group for starting. Me and Amanda are together in this group, and we want to bring a better life to Arkansas. We want our clients to be happy where you at in their lifetime.
When I extended invitations to join the council, Noel was the first one to reply saying, I'm in. So welcome to the council. All right, next is Kesha Pilot.
Thank you, Mr. Patterson. My name is Keisha Pilot. I'm from Hot Springs, Arkansas. A disability advocate since I had my car accident in 2012. I fell asleep driving home from Florida. And ever since then, I have been learning about Medicaid, Medicare, and complex rehab technology and things like that. I've gone to Washington, D.C. a couple of times to lobby to the legislators about the importance of complex rehab technology and our ability to have access to these expensive pieces of equipment that improve our lives. I really want to focus here on elder care services because my father has just passed away, and we took care of him from the point of having a brain injury from a car accident to his death on Christmas Day. And so when we have experienced a lot of things in that time period that I would like to address, and it has a lot to do with accountability for the caregivers and for the healthcare professionals that are claiming to be in this industry for us. And I want to see more follow-up and training for these healthcare workers. And I also want to make sure that we really focus on how important it is to keep people like us out of nursing homes, and that includes empowering family members to be able to care for their elderly at home as well, which is very, very difficult in the current climate that we have going on right now. And so the nursing homes are not built for what I see as real good health care and end of life care. The hospice programs are failing, in my opinion. And from my experience, there's a lot of work to be done in the elder care. Also, with behavioral, I'm glad that we're looking at the behavioral section because my sister is bipolar, and I have had a lot of issues with maintaining her mental stability and her Medicaid and everything else along that way. So behavioral and elder services is something that's very important to me right now. And this is my boyfriend, Grant Mason, who helped me care for my father for the last 2.5 years at home. That's why we were able to stay home. If it was only based on care from CNAs that are paid for by the state, he would have died long ago. So.
Thank you, Keisha. I think Keisha was second saying I'm in. Amanda Clark, also a new member.
So I'm Amanda Clark. I am here from Fayetteville. I kind of have some different aspects to where in my past where I have built up knowledge of the system. The first one is I'm a mom of 3 children that have cerebral palsy, and they are now 25, 25, and 26 years old. They have different support needs. They're at different developmental levels, so we've kind of walked different paths for them as they've gotten older. I was also the billing manager at Children's Therapy Team, which is the largest like OTPT speech provider in Northwest Arkansas, as well as ABA, and we have a school for autism. Through that role, I learned all about billing and was there while we were transitioning to the passes, and so got to know all of the pass personnel really well. Did really have enjoyed kind of interacting with them. I had good relationship with each of the passes. Currently, my role switched, and I am a family resource navigator, so I meet with families regularly. I try to meet, I've just started the role, but I'm trying to meet with them every couple of years once the child is 13 years old. Basically walking through a resource map of what it looks like as their child ages, because we were finding that they were ready to graduate from high school and there was just no plan in place. So it's difficult for therapists to keep up with all the different day treatment centers and work programs and different things that are in the area. So that's just something I'm doing. I'm meeting with the families, walking through helping them apply for waiver is a big part of what I'm doing, is catching them and getting them on waiver. Helping with adult SSI when that comes around, guardianship, that conversation as far as that versus a shared decision-making plan or a power of attorney, able accounts, future financial planning, that kind of thing. So that role has been very rewarding because I've been able to really apply some of the life experience that I've gained, but also really opened my eyes to the kind of grim and dire circumstances that a lot of individuals face if they have higher support needs. Finding that there's a big gap there in their ability to be able to be admitted to a day treatment program, or even just receiving consistent caregiving services, because caregivers are exerting a lot more energy to care for these individuals, but being paid the same as if they move to somebody with a lot lower support needs. So anyway, some desperate situations. So I want to be able to help that.
Thank you, Amanda. Shannon Long's one of our returning members. Couldn't be here. She's a big supporter of the ABLE accounts that you mentioned. Karen Baker.
Oh, hi. I'm Karen Baker. I'm from North Little Rock, Arkansas. I have 3 adult children, 2 grandchildren. And I became interested in the program in 2020. I found out that my daughter was bipolar and she has some schizophrenia, and it was surprising with her age that we had never saw it before, and she had a huge episode, and she's had several since, and it's not easy getting her the services that she needs at that time. And also in 2020, I became disabled myself when I had a parasite in my eyes, and I lost one of my eyes, and I have vision problems with the other one. So I'm just trying to learn what I can, what services are available, because I don't know of anything but like Lions World for visually impaired. But I do receive AR Choices. It's not an easy program to get in, but I receive that service myself so that I can receive home health services. But that's about it. I want to learn as much as I can, because there are also other issues. I have guardianship of 2 of my nieces that deal with severe behavior issues and just things of that nature that I want to gain as much knowledge as possible so that I can share it with others as needed, and to be able to assist myself better, because a lot of the information that I'm given is like in paper format and stuff, and I can't see paper, and I'm not able to read Braille because, like I said, I'm newly visually impaired. So I have a couple of hurdles myself that I'm dealing with on that front. But I just want to learn as much as I can and provide whatever information I can to try to help the services become better. And my likes is true crime. I like listening to the podcast or watching true crime.
All right. Thank you, Karen. Next is Diana Mathis.
Hello, my name is Diana Mathis, and I live in North Little Rock, Arkansas, and I'm original from Cotton Plant, Arkansas, and still reside there also. I'm the mother. I have 4 adult children. I have 2 sons that's on the autism spectrum. One is verbal, and one is nonverbal, 22 and 27. I have a 28-year-old daughter with cystic fibrosis, and we all had to deal, due to their disability, we all relied on the Medicaid service, and also is their caregiver. Because of their challenges, my family has faced with getting the right service supports in place. I have learned to advocate not only for my children, adult children, but for other families in similar situations. I joined the Medicaid Client Voice Council so I can share the reality of what family like mine have experienced, help improve communication between clients and the Medicaid program, and work towards better access, coordination, and respect for people with disabilities and their caregivers. I also have served on the Arkansas Children Hospital Advisory Board for several years, and when my daughter transitioned to University of Arkansas Medical Science, I served on the UMS Cystic Fibrosis Advisory Board. And thank you for the opportunity to serve and to bring our family voice to this council.
All right. Thank you very much. Jeanette Williams-Smith.
That would be me. Hello, everyone. I am Jeanette Williams-Smith, and I am a social worker by profession. I am a guardian and mother to my twin sons, Caleb and Cameron Smith. And what brought me to Medicaid waiver is I'm hoping to get some relief of my anxiety because that paperwork is killing me. But mainly as an advocate and as an advocate for Caleb and Cameron is well, let's just say something that I would like to do is watch TV. I get to do very little of that, and I would like to do some of that. So with Medicaid, being on the Medicaid Client Voice Council, I hope to be able to gain more information. As a social worker, I am referred a lot of people. I have become the face in my family, so if anybody has an issue, they're going to refer them to me. So I like to keep up on, how do they access waiver. My sons are 28 years old, so we've been on a journey, and I don't really remember that beginning journey, everything, and then things have changed. So being able to keep up with what's going on, where do I refer people? With Caleb and Cameron, it's been since the intellectual disability that they were pretty much born with. So in addition to that, they've been diagnosed with serious mental illness, which has been really consuming our lives. And how do you deal with that? And just being in the field, and I don't know about anybody else, but I received the call when my sons became manic, and there was no relief. I had to drive and get them. I had to drive and get them, figure out what to do, maneuver through that system. Was able to do that, but I don't think I could have done that had I not had the background that I have. And that's very, very difficult. And even now, I ask, are mine the only ones with a mental illness? Because I'm getting questions like, I need you to come, but I said, are they the only ones with a mental illness? And I'm not blaming workers. They just don't know. And I'm trying to pull myself kind of out of the center but I am still navigating appointments, psychiatric appointments. What does becoming manic look like? It's different for every person. So what I hope to gain is actually some relief from my own anxiety.
Thank you, Jeanette. There were two new members who couldn't be here today. Well, Jennifer Prunty actually had one meeting she was at last year, but we're going to count her as a new member, so she has 2 years of service. And she's from Jonesboro, and Carrie Evans is from Cabot. She also couldn't be here. So pretty good attendance, so thank you all for being here. Thank you for sharing a little bit about yourselves. The neat thing about being on this council is some of the things Jeanette just mentioned, you now have access to not only myself, but through me to other members of DHS who can assist you. We want you to bring your experiences, your life experiences, your frustrations to the council and share, but to get help with your individual issues, come to me and we can work kind of offline. Here at these meetings, we want to think about Medicaid population as a whole. And we want to find solutions, whether it's better communication, whether it's better training, whether it's whatever you guys come up with. Your job is to try and improve the way Medicaid is administered in Arkansas. Its efficiency, its effectiveness, the populations that it serves. Your job is to find ways to make improvements to that so that the entire state benefits. And then the Medicaid Advisory Committee, who meets after this meeting, also that's their task, is to find ways from a provider perspective. That's made up of providers. How can we, maybe it's a billing issue, maybe it's a rates issue, what can we do, what can they advise DHS? We're looking for advice. This is an advisory committee, the Medicaid Advisory Committee, obviously it's in their name, but all we can do is advise. We come up with good ideas, and DHS takes those ideas, considers them, sometimes implements them, sometimes says, well, here's what you don't know, here's why we can't do that. There's federal rules that prevent us from doing that. So you guys come up with the ideas, we make the sales pitch, and DHS then can consider the ideas that we come up with. So that's how we're going to work together to improve things for everybody. At the end of the meeting, we're going to vote for a vice chairperson. So if you're a new member to this council and you want to be Jennifer's vice chairperson, it means one, you'll get to go to all those MAC meetings. The chairperson, the vice chairperson, and then a member at large attends the MAC meeting that follows this. So you're going to have lunch at noon. Then the MAC members start to come in at 12:30, and then the MAC meets at 1. And they generally meet for a couple hours. So you'll get 2 stipends, one for attending this meeting, one for attending that meeting. You'll still only get 1 travel reimbursement because you didn't really travel anywhere else. So, but you'll get an extra stipend if you want to be the vice chairperson. So think about it. Is that something I want to do? Can I commit to more time on these meeting dates? And do I want to be chairperson next year? Because Jennifer was vice chairperson last year. Now she's chairperson. So you will ascend to be chairperson next year if you're elected vice chairperson today. So it's only open to the new council members who are here today. So we'll do that at the end of the meeting after the open discussion. But right now we have another presentation. Nell Smith is the Deputy Director for the Division of Medical Services, and she is going to discuss proposed changes to the Our Home waivers that have been sent to the Centers for Medicare and Medicaid Services for approval. We're still in the federal public comment period, so there's still time to offer input on these, but she's going to tell you what these waiver changes, what these proposals are, and how they'll affect waiver members.
It is really just an honor to be addressing this group. This is the first time I've had the chance to do it, and I thank all of you guys for serving. I hope we can all together make Medicaid work for people. I was thinking about the anxiety, reducing the anxiety. I asked our billing system team, I just wish it wasn't so hard. I just wish it wasn't so hard. And I think that's the experience that we're trying to, we want to make it easier too. It's just hard. But that's the goal. Just make it easier. All right. So I'm going to talk about the Our Home waiver renewal process, and we'll start just with an overview of Our Home in general. This is our Medicaid expansion program under the Federal Affordable Care Act. So back in 2010, you might hear called Obamacare. They passed the Affordable Care Act, and that said that states could expand Medicaid for adults up to 138% of the federal poverty level. So states got the option to do that. Some states decided not to do that. Arkansas did. And in 2014, we started out as the private option, you may have heard it called. It was then Arkansas Works, and now it's called Our Home. But it serves adults between 19 and 64 years old, and they have to have a household income below 138% of the federal poverty level. And it's a very big program. About 220,000 adults are currently enrolled in Our Home. And the 2025 expenditures totaled $1.8 billion. So it's a big program affecting a lot of people and a lot of money. Thankfully, the federal government pays 90% of that expenditure, and Arkansas pays just 10%. And that's a different match rate than some of the other Medicaid programs, which have a lower federal match, and Arkansas is responsible for paying more. So we're very thankful for having the federal government pay such a large portion of this very important program. So we established this program as a Section 1115 Medicaid waiver. Some of you talk about waiver and getting people onto the waiver. This is a different kind of waiver. It's a different program, so it's its own separate thing. But a waiver allows a state to, if it's granted from CMS, allows a state to just run their program a little differently. We don't run it exactly the way the Federal Affordable Care Act says we should run it. Instead, we have this waiver that allows us to buy private health insurance for our beneficiaries. So we actually purchase, as if we are a family of 220,000 adults, we purchase individual private health insurance plans. From Blue Cross, from Ambetter, QualChoice. We have 6 qualified health plans that we purchase from, and we have, they're run by 2 carriers, Blue Cross and Centene. But it is just, we are purchasing private health insurance. They have a policy number. They have a card that says Blue Cross. They take it to the doctor. The doctor may not even know they're on Medicaid. Because it's like, again, like we're a giant family of 220,000 adults purchasing a plan. The waiver also, a component of our waiver is a program called the Life 360 Home Program. And so it's sort of a program within a program. So this program, Medicaid contracts with hospitals. And then hospitals partner with or create a home visiting program. And the home visitors can then go see, provide services for high-risk women with high-risk, who are pregnant with high-risk pregnancies. So we started out, we had 3 different types of Life 360 homes, but now we're really just focusing on the maternal Life 360 home. So it's sort of a program within the Our Home program, and it allows us to spend money, Medicaid dollars, in ways that we wouldn't normally have the option to spend them. But it's been a very good program getting up and running, and so we are planning to continue that. Okay, so the Our Home waiver renewal, CMS approves waivers to last only a set number of years. So our home waiver was approved beginning in 2022, and it will expire in December 31st, 2026. So we want to keep that program going. To do that, we have to get CMS to approve a waiver extension, approve a new 5-year term. So state law in 2025 gave us legislative authority to pursue an extension through 2031. So that's what we're planning to do. So in the proposed waiver, we've got some things that we're saying we want to continue doing these, and some things that we say we want to do it a little differently. The big thing is we are seeking to continue buying private health insurance plans for Medicaid beneficiaries. So that's the main policy within the Our Home waiver, and we're saying we want to continue doing it that way. We also want to keep the Life 360 Home program going, so we're asking for continue that program and the waiver authorities that allow us to spend money on that program. So the things that are we're expanding. We like the Life 360 Home program so much that we want to make sure that, I mentioned earlier that we contract with hospitals to be providers of Life 360 Home services, the home visiting services. We now want to partner with federally qualified health centers or another entity who we want to contract with, not just hospitals, but with other programs who can enroll as providers, then hook up with home visiting companies and provide home visiting services to women with high-risk pregnancies. So the basic goal is we really want to make sure that as we are having hospitals shutting down their labor and delivery departments, we want to make sure that we have some services that are helping and supporting those women in rural areas that may not have a close connection to a hospital or to OBGYNs. And I should have said that the Life 360 Home doesn't provide medical services. All their medical services continue to be provided through their doctors, through hospitals, but the home visitors are there too as supports. So these are the things that we are requesting to change, and these are a little complicated. I'm going to try and not bore you to death, but I can't. No promises. So pharmacy rebates. Normal commercial health plans receive rebates that are financial incentives from the drug companies to do certain things, put them on their formulary, put them in a certain place on their formulary, that kind of thing. But the idea is that health plans are getting money back from the pharmaceutical companies. So our current agreement with CMS says we're not asking for those rebates to come back to us. So the waiver proposal, and this was a state statute that changed too. The waiver proposal seeks to require our home health plans to give us those rebates back. So instead of the health plans keeping them, they're going to be returning them to DHS, which brings costs down. So the second one is a medical loss ratio. And this is a percentage of, in regular health plans, there is a percentage that is what percentage of the health plan, the premiums collected on those health plans, what percentage actually got spent out in medical claims. And the idea is if you had 50-50, you're paying a lot in premiums. If it's 50%, you're paying a lot in premiums, and you're not getting those claims back out. So there was a threshold, and the current threshold is 80%. So health plans have to spend, of the premiums they collect, they have to spend at least 80% of that money on your claims. And if they don't do that, if they spend 75%, they return that money to you. That's federal law. We are saying we want them to, our health plans, our home plans, we want them to do that up to 85%. So they're going to, right now they return money to us, to our big family of 220,000 people. They return money to us. So we get a check for, a lot of money if they don't spend all of the premiums, at least 80% of the premiums on medical claims. We are saying we want it higher. We want even more. So we're switching to 85. That's the proposed change. Okay. You thought medical loss ratio and pharmacy rebates was exciting. You're in for a real treat with cost share reduction payments. So health plans sold on the marketplace. We're buying health plans sold on the marketplace that anybody else can purchase. And again, we're purchasing it for our 220,000 person household. If you buy it on the marketplace, you have to pay, you might have a $50 copay if you buy that plan on the marketplace. Our Medicaid clients can't afford $50 for copays. So we have a much smaller copay amount. That's $4.70. But the health plans are you know, if they only get $4.70, they're out of pocket the $45.30. So we subsidize. We say our clients are not going to pay that $50. They're only going to pay $4.70, but we're going to pay the health plans for the difference. That is a cost-sharing reduction payment. So cost-sharing reduction is it's about 38% of the premium. So it's not a small amount. But there's a tax that generates revenue to support our home program, and it's 2% on premiums, but not on cost share. So we're now saying we're going to treat that 2%, a 2% tax. We're going to place that on the cost share. So it generates more tax revenue paid by the carriers back to DHS. So all of these things are ways to make the program more affordable. The three boring things that, that we've talked about are ways to make the program more affordable. Okay, the last thing we did is we included some changes that we wanted to make in the federal One Big Beautiful Bill. You may have heard of this, and it calls for all state Medicaid programs that expanded Medicaid to incorporate work requirements. And we're not going to talk a lot about the work requirements. These are something we have to do. We're not proposing it because there's a choice for us to do it. We've just said, here's some things that we want to add. We're going to follow the federal rules, and here are a couple of things that we want to add. One of those, so that's the One Big Beautiful Bill. New work requirements start 1/1/27. Eligibility redeterminations now, instead of annually, it's going to be every 6 months for those people in our home. And that's effective at the end of 2026. But we've said we want to incorporate, in addition to following the federal law, we want to incorporate success coaching and outbound call centers. So when somebody looks like they may not be complying with the work requirements, or they need, help accessing childcare so that they can actually do work outside the home. The success coaching is an assistance for helping people not lose their Medicaid by becoming compliant. That is, we've got a lot to do to get ready for work requirements, so that would come in, we're hoping in 2028. But that is something we would like CMS to help us pay for, assistance to get people to the place that CMS wants them to be. And Medicaid will also establish outbound call centers, so instead of just receiving calls from people to verify that they're complying or that they have an exemption, we're going to have our call center do outbound calls to make sure that there's more outreach to ensure that people don't lose coverage just because of a paperwork issue. Okay, the waiver renewal timeline. We had 2 public hearings. We had a 30-day public comment period that ended January 12th. We are planning to submit to, our proposal to CMS by the end of January, if that's still the timeline. Then there will be a 30-day federal public comment period. CMS doesn't have, this is an 1115 waiver. There's no specific timeline for CMS to review or make an approval, a decision on the waiver. But they do have a deadline in that if they want us to do anything differently about the waiver, they need to tell us before our waiver expires, so which is at the end of the year. So we hope it won't be that long that they will give us the decision, but I think when we did our home, originally it was November of the year before. So, okay, these are our contact names. And you can reach out to Nancy Watson, handles Life 360 Home. Jen Dedman oversees our home program day to day, and Elizabeth and I just hang out. but you can reach out to any of us, and we would be happy to answer questions.
So, any questions for Nell? About check. There we go.
And this may be more of a question for Medicaid because it's about a billing code. I know that our home. I have 2 children in the our home population, and I want them as independent as possible. So first of all, I'll tell you, it's been a great experience. One of them, I believe, is Blue Cross Blue Shield. I think manages one of them.
Mm-hmm. Yes.
I was a little confused because I have Blue Cross, but I want to say that he gets Teladoc benefits, and I think that's great because one thing we've said in here is that we think our Medicaid recipients should get the same ability of commercial, and that's great. Now, he didn't know what it was, and I had to explain to him, but that was okay. We worked through that. My daughter's on the Qual Choices, which has been an equally great experience, especially with the notifications coming out. But I wanted to ask because these are folks with disabilities, but they're not on the waiver. Supportive employment is a waiver code, right, Elizabeth? But are they able to get supportive employment if they're not on the waiver? Like, because where I work, we do supportive employment, so we could set up a program for our home folks to give them that type of training and type of benefit, but we can't do that because they're not a waiver member. Am I understanding all that correctly?
Correct.
Okay.
I think this is on. Yeah, I'll take that one, Nell, if you want me to.
Sure.
Yeah, no, supportive living is not even a Medicaid service. It's not a service we offer to traditional Medicaid. It's offered through the waiver program.
Just supportive employment. It's a separate code.
Supportive employment. Yeah, no, that either. Yeah, it's just a waiver service. Yeah.
Is there a possibility of us considering expanding that out to just Medicaid recipients? Because that would help a lot of your folks, because we know Arkansas Rehab Services, who helps. I think it's great you're doing the success coaching to keep everybody on track. But there's nobody developing jobs for people or matching their skills with their disabilities. We're just going to have a backlog of people losing benefits, and then people on the governor's steps, hopefully not. But I'm just saying, I'm just thinking solution-wise, it would be great if we could have that code
supportive
expanded.
employment is a home and community-based service, so it's offered through the home and community-based programs. It's not offered through our traditional Medicaid program. What the success coaching will be designed to do, and we're not going to be able to implement that immediately. We're going to be working on minimum requirements for the OBBBA or working OB3, whatever you want to call it. It has many names. So we're going to be just trying to make sure we meet bare minimum. But as soon as we're able to do that, we're hoping to implement success coaching with CMS's approval. That will be designed to help find sort of job training programs, things of that nature for people. And then also remember there's exemptions and exceptions to the work requirement that might also apply for those with disabilities. That would mean they would still have access to those job training services if that's something they're interested in, but they wouldn't necessarily have to comply with the work requirement. And we will be presenting on that, I believe, in April.
Yes.
So we'll have a lot more detail on all of that then.
Any other questions about our home waiver or anything I'll talk about? Oh, is Carrie ready? Or is there a question? Okay, hold on. We have an online question, so we're gonna go back to Crystal.
Okay, Shannon asked, what's the definition of medically frail for individuals who qualify for Medicaid instead of Blue Cross Blue Shield through our home? Can you speak on this?
Sure. There are, when people apply for Medicaid, there are a series of questions, maybe 3 or 4, that asks, do you have trouble with activities of daily living? Are you disabled? Are you blind? Are you in a nursing facility? And if you're approved for our home and you answered yes to one of those questions, you will go, and I'm looking at Mary to make sure I'm telling you straight, then you will go into medically frail. So when after eligibility, people are either in the medically frail category or they go on into a QHP.
Oh, Mary has something to add.
And just to be clear, if someone is determined medically frail based on how they answer the questions when they're applying, it just all that they will, if they qualify for our home, they're still going to be in the our home category, but they'll be served through traditional fee-for-service Medicaid rather than through a qualified health plan like Blue Cross or Ambetter or Qual Choice.
So they also, just for Amy as well, they also, if they're medically frail, they have a behavioral health condition, and they get an independent assessment, so they might not be in traditional Medicaid. They would go into the PASS. And so for PASS members, that's a different kind of service. It's a state plan service. We also have supported employment there, but based on a serious mental illness, so they might go into PASS.
All right, Karen has a question or comment.
I was just gonna ask, is that what you're talking about? Is that the same as AR choices, like what I have?
No.
Oh,
It's
okay.
a different it's a different program.
Okay.
It's Arkansas Health and Opportunity for me is the whole thing. And I don't know if Jay or Justin want to talk about our choices.
Any other questions before we go to our open discussion? Actually, thank you, Nell.
Thank
you. Before we get to open discussion, Carrie was she's watching online, and she wanted to just take the opportunity, like you all got to introduce herself to the group. So we're gonna listen to her. If there's a little feedback, we'll work on that. But Carrie, go ahead.
My name is Carrie Evans. I live in Cabot, Arkansas. I'm mom to 6 grown children. I have 2 kids on the spectrum. I have another daughter who has an intellectual disability, but is not autistic. And then I have a son with pretty severe learning disabilities. And then 4 of my children are adopted. 3 of them are Cambodian. 1 of them is Thai. My Thai daughter is pretty significantly intellectually disabled, also autistic, and has had some, self-injurious behaviors, and has been a resident at Jonesboro Human Development Center, and is in the process of checking out of there. And so I don't know. I got an email about the Medicaid client voice thing, and I used to be years ago on the Arkansas Children's Hospital Advisory Board. I had a son who passed away while a patient at Children's Hospital, and I was on that board for years, and just thought that this might be something that I could lend some opinion to, which is something I always have plenty of. So I'm glad to be a part of the board, and I also am have been. I'm currently on leave, but I have been a employee of Easter Seals, Arkansas, and I am a teaching assistant there at the Center for Training and Wellness on Cantrell Road, which is a day program for adults with intellectual disabilities. So that's me. We used to live in Cambodia, so last year I went to Cambodia for a month, the Dominican Republic for a week, and Belize for 5 days. So that will probably not be my reality this year, but I did get to do that. So anyway, that's a little bit about me.
Thank you for sharing, Carrie, and we will look for you at the April meeting, and Stephen will take your photo. You missed out on the photos in lunch today, but you'll get them in April. Who does? Okay, Shannon Long, who is a returning member, is also watching online. She'd like to say a few words to introduce herself to you. Go ahead, Shannon.
Okay, yeah, but my name is Shannon Long, and I am a person with quadriplegia. I have a disability. I'm also on the Air Choices waiver. Um, I also work for Project Day Win. It's a WIPA initiative, a grant initiative that helps individuals with who are on SSI and SSDI how to understand these work incentives and how to understand Medicaid work incentives in our state to further indep- to further independence for individuals with disabilities who want to actually go to work. So not only am I on the Air Choices waiver, I'm also on the Working Disabled Medicaid program. So, and that just allows me to work and earn even more and stay on the waiver without um, much resource limits or income limits. So my main goal here is just to advocate for individuals' choices and their ability to go to work. I'd like to give a shout out to Miss Smith. We've Jeanette Williams Smith. We've known each other for quite a while. But anyways, that's what I'm here for. And if I can be of any assistance to anyone who's on these programs and has questions, I certainly can answer that. And so I do have individuals who are on the Air Choices home waiver who are often getting Blue Cross Blue Shield, but then I come across some that are on just straight Medicaid for medically frail. And I just kind of wanted to know, which you guys clarified, like the exact definition of it. And I guess it's just a check on a box for the application process. Um, but anyways, that's a little about me, and hopefully I can be at the next in-person meeting.
All right. Thank you, Shannon. So we've got a little over 20 minutes left. There's 2 agenda items left, so we're going to kind of kill 2 birds with 1 stone here. As we talk about open discussion, you can talk about any Medicaid funded program, want to bring up an issue or a point or a suggested improvement, please do. But as we do that, think about what are some proposals that we could bring to the MAC. Now, the MAC is a body made up of Medicaid providers. So things in the provider realm that you think could be helpful. I know that Jacqueline has shared some suggestions with me through email on ways to attract more workers into home health care, whether it's through bonuses or just she had a lot of ideas that she may want to propose. But we can bring up to 3 proposals to the MAC each meeting as far as what providers, what would be some ideas that could help, that the providers could help with. And so first, we'll open up the discussion. Anything that wasn't covered in the agenda that's Medicaid related, raise your hand. We have DHS experts in the room, and if they're not here, like I said, I'll jot down your issue or your question, and we'll get back to you on it. But who wants to start us off? Anything on your mind? Oh, the ones from last meeting. So.
A lot of the proposed ideas that we have from our previous meeting, we actually have been doing Zoom meetings. So we, a lot of discussion is about the past comparisons, which we did talk about the act that came about. But this is more of like providing comparison lists for clients who are, thank you. For clients who are just now receiving PASS, and so that they could have a better opportunity of picking a PASS that is actually better for them, because there's not a lot of education on that, and going to 4 different websites is really hard. So we talked about bringing up that maybe there could be somebody, a liaison or somebody that could help between the DHS and the PASS that could help people decide which one they could choose that would be better for them. And then just the waiver wait list, like, waiver task, like maybe developing a waiver task force, and finding out what people can receive when they're on the wait list. So those were like the 2 biggest things that we discussed earlier. And then as he's saying, Jacqueline was, and I'm with Jacqueline too, like there is not enough, advertisement for a waiver, like to be an actual waiver worker. And so we were wanting to maybe decide how we could be more beneficial for that as far as getting it out to the public, like these
As far
are
as
jobs.
recruitment of new
Yes,
jobs.
This is a job that you could do if you enjoy this kind of stuff. Because I am a waiver worker. And I actually just found out because a parent asked me to take care of their child. So that's how I discovered it. I didn't know that that was an option. So yeah, that's some of our big ideas that we have.
Hold on.
Waiver.
So the question is, which waiver are we talking
Disabilities, intellectual disabilities, CS.
CES
Yep.
waivers. See, I'm going to come over to Jacqueline because we've been mentioning her. You probably have something to add.
Well, it was specifically home and community-based waiver that I was referring to, but it could actually apply to any waiver that you chose to use the model for. I think it would be a good idea to interview parents, clients, and workers, and if they choose to participate in an interview to talk about the positive benefits of how waiver has impacted their lives, maybe have them sign a media release to cover yourselves and to cover both parties that are involved, so that way if they share something on the air, they're doing it out of personal choice and nobody is held responsible for comments that are made. I also thought it might be a good idea to provide an incentive program to providers, kind of like a point system to offer to workers, where if they show up eager to train on time with good attitudes, that they can accumulate a certain amount of points to earn bonus checks or gift cards or free coffee, movies, any kind of incentive just to like keep people motivated and to know that they're appreciated and valued, because everyone comes from different journeys, but I know without some of my waiver workers, I couldn't even graduate college with 2 degrees or get up out of bed in the morning to be able to start my day. So that's where my thought process generated from.
Yeah, so Jacqueline has, raising salaries is always the first thing on the list, but Jacqueline's been thinking about other ways to not only attract but retain workers who serve her and others and who are dependent on those workers. How do we increase the workforce? So that's something she's been, we've been emailing about, trying to come up with some ideas.
And what we talked about with the group, we've been meeting several times. It's been great, and welcome to all new people. I'm so excited to have different people from different backgrounds. But we talked about like a provider incentive program that ways for the passes and Medicaid to highlight the great waiver providers. And like we, from provider angle, we highlight our DSPs of the month on the DSP celebration month. But it would be great because statistically, most of our DSPs are family members. 78% are family members. But when you don't have a family member and we're trying to hire somebody, you don't even have anybody to take care of that person. And like she said, it's just so impactful. I couldn't be here today without my DSP worker because my son is pretty much total care. But and when he's not in school, then who's going to take care of him? So just an extended program to highlight that, to hear from, the passes from y'all who's good. I know you can't lead people towards a certain provider, but it would be great to know. And I think the act that came out about those stats for quality, it would be great to know, who's doing well. And I think providers would love to hear that. Like a lot of providers have different programs like Easter Seals that roommate housing program is phenomenal. We have different programs at where I work, but nobody really knows about that and nobody really hears about it too much unless you're doing your own advertising. So we talked about provider recognition and the waiver task force just to put everybody on there so everybody can align as providers and you can have different people from different backgrounds. Summit is actually running a waiver task force right now with care coordination. I don't know a lot about it, but they announced it at DDPA. It'd be great to know more, but we would love to do that. And then I thought, Jennifer, you had a great idea about what we're talking about with the passes is like a needs assessment, like a person that's not working for the passes, that has no horse in the race, that's not working maybe even for you guys. I don't know who they'd work for, but literally sits down with a parent and says, what do you need? What do you need for your child? What's most important to you? Are they high medical? Are they this? Are they that? Do they have 12 diagnoses like my little boy? Do they just have one? Do you need ABA? But right now that doesn't exist. So for parents, and for the family, to sit down like a needs assessment process of what do you need? Like I don't know if you want to call it an intake. I'm clinical, but just somebody to talk to. Because otherwise, I had to call all the passes, and I worked for a pass to see what they had, and then I had to go on the websites. And I know that's my job as a parent, but it would be great to have somebody that knew everything about the different passes, and that say somebody comes from a different state and they got to choose quickly. Well, you want to choose somebody that I think the stats that are published out there and what we did with the act is going to be great, but it would be great to have somebody just to talk to.
So if they were to bring that, I'm asking the leadership here, if they were to bring that idea to the MAC, a pass expert who is an expert on all 4 passes who could meet with families and try to direct them, is that even a possibility?
Or does that person exist and we just don't know about them?
So, we contract with AFMC, and they can, help people find information. But I think we have to be very, very careful when we're talking about competition between passes and the difference between passes of legally what we can do as far as guiding somebody. So I think
and not just the passes, but like the person that asked about the waivers, like if somebody is there a person now that exists that if I'm just a person that moved to the state and don't know what waiver to do or how to do that, is there a person that could get on the phone with me that could walk me through, well, this is what your kid or family member has going on and this is what waiver?
I think, and Elizabeth just mentioned in my ear is that, so the piece about with the passes is back to, we can't do choice counseling, right? So, and I think that's what you're talking about is choice counseling. And so,
not really, but what about education about not choice counseling. I don't know what that is, but like the coaching that you're doing of, hey, here's the education.
But it would always lead to, the ultimate intent would always be to provide information to assist someone in making a choice. And so the ultimate thing that would happen there is someone would be making a choice based on the information or coaching or whatever it was that the state was providing, and that would be what the problem is.
I understand that, but also we need that for like the waiver. Like we have a person here today that's like, I don't even know what to do. I don't even know what waiver to apply for. It's just a lot of, like an advocate, if we could be like an advocate is what I'm talking about, more of a.
Is there like a law that you're referencing there that causes it to be illegal to coach?
It has to be written into our waiver that someone is doing choice counseling for us, and we don't have that right now, I don't think. Yeah, the 1915B.
So the PASS is a managed care program, and so we have to follow managed care rules for that. And the PASS serves two populations: those with the intellectual or developmental disability that are on that waiver, and then the second population is an individual with a serious mental illness in a certain Medicaid eligibility category, or for children, a serious emotional disturbance. And so if you're talking about, and what I heard you guys saying was trying to help them choose which of the four passes that would be best for them if they're coming in new to the pass. And so and so we were talking about the different. Okay, so yeah, so that's what we were answering is just about us being able to assist somebody in choosing one of the four managed care programs, choose between the four managed care programs during their first 90 days.
Yeah, so it's not for persuasion though. This is the thing. Like, if I'm a brand new person that is going to be placed on pass, they just automatically put me somewhere and say you have this many days to change.
That's right.
How is that person going to discover the other pass, like what they have to offer, if there's nobody to tell them? That's what we're trying to say. Like, there is not a place where you can go and see all four passes and say, oh, well, this one doesn't provide with my doctor. This one doesn't provide ABA. This one doesn't provide. Like, that's not fair to anybody as a client.
So they all have to reimburse providers, so they have network adequacy requirements. And so they all have to have every provider type, so they all have that same process. So there's not a pass that can say, I don't provide that service, or I don't purchase that service, I don't reimburse for that service. So that's kind of the floor of it, right? Is that they all have to pay for, and they all have to have network adequacy. And that's part of the things that we assure is network adequacy. And so that's kind of the starting point. And so then the other things that you would look at to make that choice would be, is the provider that I've been using in their network. And so I think that's the piece where that's such a moving, right? It may move. They may sign an agreement with them 1 year or a contract because they contract. And so we wouldn't have a website that could do a comparison just because of that moving thing. So I think the best way to help families of understanding that, and since we can't do that as, either a state employee, or we can't guide people, I think that's excellent to be thinking about how do parents do that or help people. And we might be able to put out like some sort of guide of saying, here's what you want to look for when you go into those past websites, right? Is your existing doctor, do you have a primary care physician? Do you already have a provider? So that would help if we had like just kind of like a guide.
Yeah.
Guide of like, here's what you want to look at when helping.
Right. No.
So you're not just clicking around on a website.
I know that would be a no-no.
Just clicking around on a website saying, oh, I don't even know what to click on next. Okay.
Yes.
Okay. Got it.
Yeah. I mean, like a patient advocate, in my opinion, a patient advocate is somebody who would tell you like, these are the things these offer. These are the four things. And by that, you can look on these websites and choose. Like, just somebody to push them into those things. Not like, I want you to choose this one because they provide your doctor, or I want you to choose. It would be more like, these are the four things you need to go to, in like an easy tab or something that you could say, these are the four options. This is what they offer.
Well, if we
waiver provider, nobody knows how like a guide about what to look for a waiver provider.
Yeah. So if we start out, and we can do pass related, but if we started out with that base, then you guys would help us to really kind of develop out something that is more of a guide that we can put on our pass website, right? Yeah. Okay.
Yeah,
so but you would help us with like what would you have needed to know? Okay.
That would be
Okay.
perfect.
We can commit to starting out to that that base guide of what it looks like for everybody, so
Well, and not just the passes, like Jacqueline was talking about the waiver providers or facility, and you had a really good idea about a big brother, big sister kind of waiver program where a parent that's been through it, like mentors, if I read that right in your email.
with the added component of someone who's living with the disability.
I mean, I feel like it would benefit the passes too. That's my thought is maybe. I just feel like it would also benefit the pass because then, like, they're not going to get a client that lives in, like, say, in my area, Gentry. There's no GYNs. There's no, we don't even have a eye doctor. Like, we have to go to Rogers, Bentonville, Fayetteville, whatever. I just feel like people that live in those kind of areas, they have no idea, and then they pick one. And I'm sorry, you can't go to children therapy anymore. You're going to have to drive 60 miles to the next one. It would just benefit them as well. That's my thought.
And so I just wanted to echo what Paula was saying in regards to waiver and guideship. Of course, I got to defer to Jennifer Brisset, who's the director. But I'm open to hearing some of the things that y'all are dealing with, the questions that you have. I mean, we only know what we know when we're doing the work. And so I'm happy to hear this so that we can know what to take back and what to work towards going forward. So I'm here as a point of contact to work directly with y'all and making it easier and more well-known for go forward.
So it sounds like we're going to work together to develop things to consider when you're choosing a waiver, when you're choosing a pass, when you're moving to the state and want to know what's available, just kind of some generic process to help people who are selecting plans, selecting programs. So yes, I'm Karen. I'm on my way back.
Waiver worker, is that like a care coordinator? Is that somebody that helps you when you're trying to get away? I don't know exactly what that is. I've never heard of it.
Okay. The caregiver?
Oh, okay.
Okay. All right. We're almost at time, but I'm come over to Amanda. We're going to do an election here in a second.
I wanted to just bring up, I mentioned a little bit, but I serve a lot of families that have higher support needs individuals, and after high school, there's just not a place for them. The ADD Teach Centers, I will call around a lot of them just to ask what their entry requirements are, and most of them will answer that they need to be able to toilet and feed themselves in order to be admitted. And so even when they ask their care coordinators, the answer they get back is that usually one of the parents quits their job. And so that's not a great answer. That even takes somebody out of the workforce that actually was contributing to Arkansas's, their revenue. So it somehow there needs to be an answer. I know that there's just one rate per individual, so maybe a tiered structure, but also there's even a problem in our area with there's a lot of wait list, and there's an inability for a new provider to enter and be an ADDT center because you can only be an ADDT center if you already have a license. And so that is a barrier to entry, as well as the fact that honestly the model, these individuals need to be in community, and right now they can't leave the center during the day. And so just the opportunity to really kind of look forward to a little bit as to what could that look like, where the members are able to be in community more, have volunteer opportunities, have our opportunity to explore some of the things that they might be interested in. One of the great benefits of it I personally, my son is at an ADDT center. He is higher support needs, but his center, they actually allow, they have 100 individuals and they have just 4 slots for individuals with higher support needs, and he has one of those slots. And so there's a wait list behind him. So my family's being served, but having him there, if somebody calls in or whatever, he's still served. If I were to try to do the same thing through supported living, it's just, I've tried, but it's like I'm my own small business trying to hire the staff to cover those hours, and then somebody quits, and then all of a sudden I don't have somebody, and it may take me a long time to replace.
So if we were going to the MAC with this, some of the problems I'm hearing you saying are isolation of adults with disabilities, opportunities to enter a workforce, community. So you would have to come up, that's the problem. Mm-hmm. Now we'd have to propose a solution to pitch to the MAC. What are some ideas? What are some things that could help in these areas? So that's the challenge. We can identify the problem, then we have to work with the MAC or with the agency to come up with solutions for it.
So increased reimbursement based
Increased
on tier,
reimbursement.
removal of the ADDT license cap, and then removing the walls. Right now, there's actually a requirement in the ADDT centers that they cannot leave the facility. And so some of them get around that by having multiple facilities that they move between. But like I said, my son is in a wheelchair, and so he actually doesn't get to move between the facilities because they're not all accessible to him.
When you say leave the facility, you just mean go outside? Do you mean go?
They aren't allowed to be in community, like they can't, they have to be within their own walls.
Okay.
Yeah.
That's been offered to one of my sons, like he could participate in 2 different programs to get
Right,
those
from the
benefits.
same.
But yet my other son can only participate in the one where he just sits there all day.
Yeah.
You know, so what are the, you know, it's crazy.
All right. So, unfortunately, we're out of time. Jennifer's been taking copious notes. Maybe we need to elect a secretary for the board. So, of the new members, who is interested in serving as vice chairperson? If you are, just raise your hand. I'll give you an opportunity to make a minute pitch. If she's the only one, it's going to be an easy election. Up 2. All right. Keisha and Amanda. So just tell us why you're interested in serving as vice chairperson.
Karen? Okay. So just, I can reiterate just a little bit. Just had kind of a background with raising 3 kids with disabilities. They have different support needs, different developmental levels. So I've kind of hit different services as they've gotten older, as well as just interfacing as a billing provider and seeing that aspect of what it's like to be on that end, meeting requirements in order to bill and be reimbursed, both by Medicaid and the passes. And then currently meeting with families and just finding that there are so many really difficult and hard situations, wanting to help those families. Honestly, seeing a lot of our individuals that are ending up in nursing homes, which is also a big concern of mine because it's almost like the passes are there to keep them in community, yet if they end up not being able to keep them in community, that doesn't really count against them. I don't know that, like once they move into the nursing home, it's almost to the benefit to take somebody that's using a lot of pass dollars and put them in the nursing home. So just like I said, seeing things that I would love to be able to have a voice to be able to change. So
Keisha?
Hi, everybody. I'm Keisha Pilot. I would like to represent you all on the MAC Council because I have what I'm going to bring is basically the senior care experience at this point. And we're all going to be needing nursing home care and CNAs, and we're all going to be needing a place to die one day. And I'm very scared in this what we have going on right now to die in one of our nursing homes. I encourage all of you to, whether or not you vote for me, if you have anyone in a nursing home, go look under the sheets, look at your bottoms of your family members, and be very involved in their care because the nursing homes are not doing well. And essentially, I would love to see some real change in our elder care services, and I look to what happens, how we treat our younger developmental disabilities population to help with that, because some of these passes and things are not eligible for our senior care. My father would have never been able to go to a brain injury recovery program or be with other people with brain injuries because of his age here in Arkansas on Medicaid. And so I would have loved to see some changes there with our brain injury program and senior care services.
Yes. I'm Karen Baker. I don't have as much experience with the different programs that are offered, but I do have. I learn very quickly, and I'm willing to learn and take the time to do the research to figure out exactly what services are out there to offer assistance to people who needs these services. And like I said, I have the time, and I'm able to do whatever it takes to get the services and to find out, like I say, what services are out there and try to get the steps needed to get to these services, because that was one of my own personal struggles, and that's why I'm here. And I've been making the calls and doing what exactly is needed in order to try to get to a resolution. And so like I say, I'm very good at that. A fast learner, and whatever there is needed to be done, I'm willing to do.
All right, so I've given you each a piece of paper. You have three choices: Amanda, Keisha, or Karen. Remember, this person will not only represent us on the MAC as vice chairperson, they'll next year become our chairperson for the Medicaid Client Voice Council. So just write the person you prefer to be the co-chairperson on. Oh, I didn't get you one. On your piece of paper, and then just fold it up, leave it on your table. Also leave on your table any of the information sheets that you filled out for me, and don't forget to do your mileage reimbursement sheets for AFMC so you can get paid if you drove here. If you need any help doing that, the ladies out here can help you out. We have the room now until 12:30 to eat lunch. Then the MAC members will start filing in, and they're going to eat lunch before their meeting. So go ahead and go out in the lobby, grab your lunch, and thank you all for being here. We appreciate it.